Hello, Instagram world and Facebook world this morning or this afternoon, wherever you're joining in from. If you're watching on the recording or the replay, stick around. We're going to be talking about brain health and early intervention and some of my thoughts on preventing autism. So this is going to be a great topic today. If you are joining me, let me know if you can see and hear me okay. Let me know where you're joining in from. I am joining you from Citrus Heights, California. Hopefully I'm live with you on Facebook. I don't know yet. I can't see. Here we go. And early intervention. If I mute myself, can you guys still see and hear me? Check and see, please. And let me know, okay? So, and then hopefully I can see your comments here. So today, some of the inspiration for today's topic, today's Free Friday topic, comes from this book right here, How to Prevent Autism by doTERRA Berger. She is a documentary filmmaker, and she has one child with autism, and her second child has many less symptoms. So, and she did some interviews here. So this was kind of the inspiration for some of this, but let me introduce myself. My name's Amy Miller. My husband and I, we are the founders of 3 Life Essentials, advocating wellness in all areas of our life. I think I've got it here as long as you can hear me okay on there. So I think I'm good here. Thank you. Hey, Rhonda, good to see you this morning. So, we are advocates of wellness in all areas of our lives, and we're here committed with you on this journey for wellness. I've got something in my eye. Okay. My background in working for a little over a decade as a speech language pathologist, I worked in early intervention, as well as also supervising some speech pathology students and assistants. And I really enjoyed researching and pouring into the lives of those with special needs and challenges. And so today, this is Free Friday, right? Our weekly series to live life more freely, more abundantly. And today we're going to be free from ignorance, free from fear, free from blame, free to intervene early, and free to live well. Now, I'm going to take a few of my vitamins and supplements. Let's see, I've got some myzendocrine oil here. I'm really thirsty, so I need to take these. This is my husband says, mom, get off the news. This is my phytoestrogen that kicks off all of the fake estrogens in my life. This is my new yarrow palm capsule that my body is loving it. And let me know what your thoughts are on this topic so far. So, so as I mentioned before, this is the inspiration for today's topic today, but I want to just give a little bit of background here. I want to make sure that today, if you're joining me and you have a child that is receiving early intervention, or you have a child that you're wondering what the diagnosis is, or maybe you have a child with autism, or maybe you yourself have autism and you've discovered that in your adulthood. I want to encourage you that we today are not going to live in a space of, if you would have blank, then your child wouldn't be blank. Okay? We can't live in that space of blame or shame or anxiety of the what if. But what we can do is we can learn from the past. We can prepare for the future. And so if you're watching this live, or even if you're watching on the recording or the replay, I want you to please, I urge you to click the share button or tag a friend or a family member who either, if they have a child with autism or a family member with autism, or if you or someone you know is pregnant or trying to get pregnant. We want to do as much as we can to learn from the past and also to prepare for the future as best as we can, right? So let me give you a little background. And so when I was in graduate school for speech language pathology, this was in the mid to late 90s. I don't want to age myself too much, right? Autism was barely covered at all. There was no course on autism. It was mentioned briefly in a few courses. I never recall seeing a child with autism in grad school externships or anything like that. And I started practicing in 1999. I worked in a public school setting for 3 years as a therapist, and then as a supervisor off and on for the next 7 years. And I began working in early intervention in 2001. And over the next few years, we started seeing reports of numbers of, 1 in 168 were diagnosed with autism. And then over the next 15 years, those numbers skyrocketed. 1 in 150, 1 in 110 in 2006, 1 in 100, 1 in 88, 1 in 68. And now the number is 1 in every 59 children born are now being diagnosed with autism or somewhere on the autism spectrum. And this is why this is relevant right here and right now. So this is why I'm asking you and urging you to click the share button and share this on your personal page, or tag a friend or a family member who is pregnant, who's looking to conceive, because what we can do now even is prepare and prevent. We can do things proactively to prevent. Now, Autism Speaks was a foundation that was founded in 2005, and I started seeing the prevalence of the change with my own eyes in the numbers that I was providing services to. In 2007, when my husband and I got married and started trying to conceive, to be honest, I was pretty terrified of having a child with autism. And because I was seeing it with myself, I was hearing about it. I was going into homes where there were families who were either new to the diagnosis, or we were seeing some heavy indicators that was the diagnosis for this child. And I saw the struggles that some of those families were having. And I wish I would have had actually some resources that I had now. I wish I'd had them back then, but it actually wasn't even in existence then. So I wish one of the resources that I'd had back then was doTERRA. But it actually wasn't even in existence then, because I was always of the philosophy that my responsibility as a speech pathologist and a communication expert, that I was to provide my families and any of the individuals that I worked with, to provide them with all of the resources that I knew available to them, and lay them out there before them, and all of the options, so that they could make the best educated decision of what was best for them. And doTERRA is such a powerful tool in being able to impact not only wellness, but actually impact brain health, immune system, and gut health, which is all covered in this book. And so let me flash forward then to when I started my own health journey. Around that same time, around 2007 as well, I was having issues with acid reflux. I was having laryngopharyngeal reflux. If you're familiar with that, I was diagnosed with leaky gut and candida. But at the time, I did not realize the connection with all of this and my own gut health, my brain, my fertility, and even what what could come from even the children that I would have. And I ended up getting connected with a medical doctor that had done her own research on gut health. And she also had been seeing some patients with autism. And so, fast forward, so I began a health journey and started seeing the power that nutrition had on healing the body and providing support. And I started learning the power of when you provide your body with the tools that it needs, that it actually can begin to heal itself. And so I had my first child in 2009, and he came out screaming, literally. And in addition, he came into the world filled with antibiotics in his system because I had the group B strep IV antibiotics. I had those pumped into my system over the 36-hour labor. And I distinctly remember how the nurses stated how overtly alert he was. And at that time, I had a lot of fear around autism. I saw how hard it was for the parents that I had been working with, how hard it was for the teachers. They had this precious child who looks very typical compared to other children, maybe with special needs like Down syndrome. With Down syndrome and with autism, if they're walking down a hallway together, you may notice more physical stature, facial differences of that child. And those children with autism have been some of the funniest kids I've ever been around. In fact, I feel like I'm convinced that God had used that extra chromosome to bring just so much life and happiness into our world. And but a person with autism, you don't necessarily usually see those physical differences, unless maybe there's some other co-diagnoses. And um, so with my first child, I did all the things. I started looking at vaccine schedule. We did a selective vaccine schedule based on Dr. Sear's book at the time. And in this book, in this book particular, one of the things that sticks with me is this. So this book follows this filmmaker, and she interviews, I don't know how many, let me see how many experts. She interviews 1, 2, 3, 4, 5, 6, 7, 8, around 9 different experts in their field, from medical doctors to registered dietitians, RNs, PA, and she interviews them all about autism and their thoughts on this epidemic, and that's really what it is. And one of the things that sticks out to me in this book is oftentimes we are looking for really one of those one-off symptoms. For instance, excessive spitting up in babies. My child was very colicky. He napped very little, and he was intolerant to milk. If any of these resonate with you, if you've noticed any of these in your own kids or with families that you know, put a comment in the comments, because this hits home with many of us, and this is becoming as prevalent as something as cancer. And so we have to begin to look at this, and we have to begin to look at this from a preventative standpoint. If we don't if we don't, we're going to be shooting ourselves in the foot. And so so kind of back where my son was intolerant to milk, I discovered when he was only about 1 or 2 months old, he had a little blood in his stool, and we would have tried soy milk at the time, but our pediatrician informed us that soy would be a problem for him too. Most that had intolerance to milk were also having intolerance to soy. And we didn't do soy with him. And I did some research on that. That soy is also talked about in this book. I remembered that I had also taken soy lecithin capsules daily while breastfeeding him, because it was the only thing that I could find that would keep me from getting plugged milk ducts. And breastfeeding was so high stress for me, and I didn't have as many of the health tools that I have now, but I did the best that I could with the information that I had at the time. And I mentioned he was very colicky. I remember giving him gripe water like crazy. I was practically buying stock in it, but it didn't really seem to help. And I knew he needed probiotics because of the large antibiotic exposure that he'd had before. And we did that. I definitely think that helped, but that can throw off your gut flora balance for up to a year. And we tried to take a more natural approach if possible. But there were not a whole lot of options out there at the time. And I remember trying some herbal tinctures as well with some minimal results. It started feeling like natural equaled weak or doesn't work. Anybody feel like that? Have you ever tried natural things and you're like, I think natural equals weak or doesn't really work as well? Put in the comments if that's you. But here's the thing. What if, let me throw out a question to you. What if we don't accept these as common childhood issues? What if we don't accept these as common? Because many families are seeing similar things that I've talked about with my oldest in their own children. And they're just commonly accepted now as common childhood issues. And we now know that there is a correlation between our gut health and our brain health. Now, my oldest is what would be considered typically developing, but I think most of that is due to the grace of God, but also because of my background as a speech pathologist and my own health issues. Looking back, I had already begun to prepare my body for him. And as you read in this book, I encourage you to check out this book as she's interviewing. They're talking, most of these experts are talking about how they believe autism is preventable, and at least in a large part. Yes, there is a genetic component to this, but there are so many other factors contributing that there are things that we can begin to do proactively to provide prevention. And if you guys want to know about this topic further and we want to dive into this deeper, put that in the comments, dive deeper, and we can go into this more, because I've been highlighting some parts in this book that I really think are beneficial, and some things that we can, some practical steps that we can take. So here we are 11 years later with doTERRA, and we personally, my family has had access to them for about 6 years. And now these young moms, maybe that's one of you, or soon to be mamas, maybe that's you, you have options that actually work and are safe. I look back and it would have been amazing to me to be able to have used an oil blend. I don't have it with me, but my oil roller, like the digestive blend or the new Tamer kids roller on his belly, so fast and so effective, or even making my own gripe water for him on occasion if I needed. The good stuff that works, the natural stuff that actually equates working, helping him have good bowel movements. Bowel movements are actually an indicator of behavior. Did you know that? So monitoring bowel movements, those kinds of things. And so, of course, we want to try to expand kids' diets, especially those with autism, beyond Cheetos and chicken nuggets, with sensory exploration. But at times, during that transition, we can continue introducing digestive enzymes. We can use digestive oils during the process, and we want to hone in on these early warning signs, because my son exhibited some of the early warning signs. And And I had already done some things proactively to help with on the prevention end. So I want to help you find ways, especially for soon to be mamas, to be able to get your own bodies in check before bringing this precious life into the world. Now, here's what we can all agree upon in this area of autism. Yes, there is a genetic factor. Yes, there are environmental influences, a toxic overload that's happening. And we can all agree that early intervention is key. Early intervention with health concerns, with doTERRA, that is safe, effective, it's an affordable place to start, and with therapy, a healthy gut equals a healthy brain. And so, so those new mamas who have a child just receiving a diagnosis, or those of you who are mamas who have an older child with autism, using your oils, or if you don't have access to doTERRA now, it's a perfect place to start. Simple ways to start. We have tools, books that you can access to be able to utilize them. We have foundational aspects in vitamins and fish oils and probiotics and citrus oils for helping with that glutathione production. Diet changes, you can continue doing these, but if you have a desire to incorporate, start something new, start with something simple and slowly introduce more as you learn your child, and as your child becomes more accustomed, you won't be overwhelmed all at once. And I want you to reach out to me, because if you are overwhelmed by any of this, like, where do I start? What book do I get? What supplements do I need to take? Or how do I start with my body? How do I help my child who already has the diagnosis? I don't want you to be overwhelmed. I want to walk you through this. So I want you to reach out to me. You're welcome to send me a direct message or a private message, and we can set up a time to chat, and we can start with just some simple steps to get started and really shift shift these numbers from 1 and 58 and get them out. I have a link that I'll share with you here in the comments on access to some of these books and other resources that you can use. And so I'm going to put that here in the link. I'm just now getting to see your comments here. Hey, good morning. Hey, Jenna, good. Oh, I'm so glad this is speaking to your heart. Yes, you're right, Jenna. Same with ADHD. And they're all correlated. And so, Jenna, if you don't have this book, I would encourage you to get it, because it's going to give you some insight, even if you have, even though this is prevention, if you have a child that already has that diagnosis, this is going to give you some insight in some things that you can do proactively now, and even if you're having future children, some things that you can do in your own life and in your children's lives. Hey, Bethany, good to see you. Lots of folks don't realize how bad the antibiotics are to your gut health. Yes. I learned that when I was giving birth to my oldest. Yep. I don't know what I would do without doTERRA either, Rhonda. Such a powerful, simple, effective tool of ways that you can incorporate in your life. So thank you guys for joining me. Next week, I need your input. What do you want to hear more about next week? How do we support our immune system naturally, especially as we're going into the winter season? Or do you want to hear about copaiba versus CBD and some of the similarities and differences and how to use both? Put in the comments below what you want to hear more next week, and that's the topic. So join me next week, and we'll see you guys later. Bye-bye, everybody.